Clear Voices of Hope is a powerful collection of voices from For the Love of Cups, Clear Pathways program, dedicated to raising awareness about the realities of dense breast tissue and breast cancer. Through honest conversations and personal stories, we amplify the voices of women who have faced these challenges firsthand, sharing their journeys, fears, triumphs, and lessons learned along the way. Each episode brings you closer to the lived experiences of survivors, advocates, and caregivers, while also featuring leading experts in breast health and women's health. Together, we break down the barriers, provide vital education, and empower listeners to make informed decisions about their own breast health. Whether you're navigating your own diagnosis, supporting a loved one, or passionate about women's health equity, Clear Voices of Hope is your source for real stories, reliable information, and a supportive community. Join us as we shine a light on the path to early detection, better care, and hope for every woman. Welcome back to Clear Voices of Hope. I'm so excited to be sitting down today with Susan Willig. She is somebody I have met recently through some advocacy groups that I've been participating in. If you've been following along, you've seen me with the Women's Health Advocates as well as the Breast Cancer Early Detection Coalition. And Susan is really active in these communities as well as her own. I think you're going to be really grateful you tuned into this message today, into this episode. And I'm really excited for you all to meet her. I'm going to give her a moment here to introduce herself. Susan, would you just tell us where you're at today, a little bit about your background and what brought you here?
Yes. Well, first of all, Lisa, thank you for inviting me, including me, and giving my voice and adding it to yours. I appreciate it. My name is Susan Willig, as you mentioned. I am CEO and Chief Brand Strategist of a firm named True North. It's a brand strategy advisory working in the healthcare space. But I'm actually here as a woman, as a human whose sister survived breast cancer, who lost both grandmothers to breast cancer. And after 20 years in healthcare, I'm just seeing more and more disparity in care and representation, both in leadership and in innovation. I mean, all across the spectrum. And so even in the last 5 years, learning more about breast health and dense breasts, and I know that sounds funny to say at my age, that in the last 5 years, but I always say, once you see it, you can't unsee it. So now I'm choosing and seeking opportunities to share with other women so that they can change their trajectory.
Absolutely. Remind us again what state you're in.
Thank you. I am in Southern California. Not that that's a state.
You are
I'm
so
in
close
California,
to me.
in Laguna Beach.
Yes, right. Because, California has been notifying women of their dense breast tissue status before the federal mandate came out. But I know, you mentioned women of our age not knowing this information, and it is shocking to, get to a point in life where you kind of think that you've well prepared, you're well educated, you're well informed, to find out that that's not the case. And I think, a lot of these issues around dense breast tissue haven't been discussed. They aren't part of the conversation. A lot of the messaging around breast health has always just been get your mammogram and then move on, right? Like nothing else to worry about. But there hasn't been a whole lot of education around next steps and breast health and what else to be aware of, especially around dense breast tissue. So I know exactly like what you said, once you see it, you can't unsee it. And I think that has been the thing that we were both really shocked to learn and feel very passionate about sharing and making sure that no other woman feels so blindsided by this type of information.
Oh, 100%. And I don't have children. I have nieces and nephews. And with my nieces, obviously I bring this up. And sometimes they're like, well, how do you know if you have dense breasts? And I said, well, I didn't know that mine were different than non-dense. I went in for mammograms. And actually, since I've been 18, just because of the high risk in my family, but nothing beyond that. And I don't even know how I uncovered it, but I uncovered it myself. And then I watched the documentary recently on Happygram, and I thought, wow, women were not told that they have dense breasts, and that further, evaluation is not just wise, but really almost requisite in your health overall. So it's just fascinating to me. So I seek to share, and like I said, I've been sharing with my nieces, and some of them now have daughters, so they'll share with their children, so at least I can make a ripple within my community.
That's where it starts, I think, these conversations and having access to these conversations and just being willing to have the awkward moment and just start being the one to share them to your family, to your friends, all the
it's
things.
not awkward for me, but that's all. Like my family knows I'm pretty straightforward about things, and especially health, I will risk discomfort to have the conversation.
Same.
I want to just say, like, your courage to consistently step out and have a voice, and it's not easy, and it is really about courage to do that. So thank you.
Thank you. I do appreciate that. It reminds me of a conversation I had with somebody around being a lifelong advocate. There's those of us that just can't help ourselves, and you're right, sometimes you don't always feel like anybody's listening, and you really do just have to have the fortitude sometimes to just believe in the importance of the message. Take a break when you need to, but it doesn't stop. The work doesn't stop. The passion doesn't stop. The desire to continue supporting and sharing is just really strong. And, so that's what brings us together. And I do love the women that it has brought into my life.
Yes.
Yeah.
Women's health advocates, the women that I have met through, just like you said, the fortitude. I love that word.
Yeah, I wouldn't want it any other way. Will you tell us a little bit about what your life was like? What your typical screening was like, and when you found out you had dense breast tissue, what did those next steps look like? I know that's a lot, but kind of a 3-part flow.
No, I think, looking back, I think maybe my gyno when I was 18 started prescribing mammograms. Now, at the time, and now I know dense breast, but it became a habit for me to get mammograms every year. And at some point, I had a lump. So I don't think I'd even had been identified as having dense breast tissue, but at some point I had a lump and escalated exploration, as you know, biopsy even went into a lumpectomy, and that's when I had ultrasound and ultimately an MRI and lumpectomy, and all was okay. But eventually I discovered, and I don't remember that pivotal moment, that I had dense breasts, and I was on a cycle of and knew that I needed an ultrasound in addition to mammogram, and then even MRIs periodically. And I may not be clinically accurate. You can correct what the appropriate cadence is. But I knew I needed escalation beyond mammograms. But I changed providers and changed insurance. And this is just recently, again, learned more, saw the documentary Happygram and how important it is to have advanced screening beyond mammograms. And that was so pivotal. I mean, to your point, that they didn't even want to tell women that they have dense breasts because we couldn't handle it. I don't know. Something about providers thought women couldn't handle. What would they do with this information? We didn't want to create chaos. I don't know, but I can't even imagine why you wouldn't want to tell the human in whom there is dense breast tissue that they have dense breast tissue. But so I'm saying that because in my case, I have a very conscientious gynecologist right now, and I felt a lump under my arm recently. This is in the last year or so. And I went to her, so it's noting it's a female, and I said, hey, I think I need advanced. I didn't have a prescription for an MRI. And I said, I'd like to get one. She said, well, why don't we just watch and wait? And I said, no, I'm not watching and waiting. I said, I'm at high risk. I didn't know my score at the time. I think maybe it's a 27. I have it in my notes. But my grandmother's, my sister is a breast cancer survivor. I have dense breasts, whatever. And she goes, huh. And she flips through the chart and she says, oh, yes, you are at high risk. Yes, I will prescribe it. So if I would have walked out just saying, okay, well, let's watch and wait, which I understand the burden to the healthcare system and things, but if I didn't know, that mammograms were insufficient for dense breasts, if I didn't know I was at high risk, if I didn't push my provider to digging deeper and prescribing an MRI, she would not have done so. So fortunately, I knew enough to do that, and that's why I'm so passionate, because this happened to me in the last, 12 to 18 months. A woman of my age, provider that I knew, a female, you would have thought all the things were working in my favor for adequate screening. Wouldn't have happened without my voice.
Yeah, and that's really the thing here, because you would assume all those things were true, right? You've been doing this for a long time. You've already been flagged as high risk. You've already been receiving, these routine adjunct screenings, and you're well educated and informed. And yet we can't ever, even if we have a great provider, we don't know what kind of day they're having, right? Like, she clearly hadn't
100%.
flipped through your chart. She had, whatever. Well-intentioned, but still they're going about their day. And we can't just assume that they know everything the way we know. And so it does matter to just speak up and sometimes point out what we think is the obvious, and just, don't go with the flow. You've really got to speak up.
I appreciate you saying that, because was not my intent, and I know you know this, but to speak poorly of my provider. You are exactly right. They have windows where they can see patients. They are humans. They're moving throughout their day 100%. Let's not even project any ill will or negative care on the provider. It's just that they're busy. Again, we know our bodies. I discovered the lump and fortunately went in and brought it to her attention. So continuous self-assessment and self-advocacy and raising one's voice. And even, I was just on the Women's Health Advocates call this morning, and Dr. Bio was talking about how she's had to speak up. And since she's been sharing her story, other women have come forth. And even if my doctor at that point had said, no, I would still say that it's still my job to push and either find a second opinion or another provider, but not take no when we know our bodies. Period. End of sentence.
Yeah, absolutely. There are definitely those times in those cases where we just have somebody that we don't work well with, and it is absolutely time to go get a second opinion and find somebody that will work with you. I appreciate what you said about, once we're notified, even today with that notification, it's still just a notification. So we've decided to let women know they have dense breast tissue, but still today the issue is what's next. Yeah. And that piece of education is still seriously lacking, and depends on how they rate your density on a scale of 1 to 4, 4 being the most dense. And based on, okay, so we can
more.
I'm going to have to.
Yes. Yeah.
I feel like I need to do a whole episode.
Yes. I didn't know that.
Maybe I'll have a radiologist on with me and do that. But yeah, they'll call it a BI-RAD rating, and they'll rate it on a scale from 1 to 4. And typically they will refer you for a follow-up screening if you rate a 3 or a 4 on that scale. They don't typically refer you for a 1 or a 2.
Okay.
I sometimes think based on your risk factor, a 2 is still worth it, because it just means that it's not throughout the whole breast, or maybe it's it's less dense, right? So there's more fatty tissue, but it still might be worth ultrasounding, catching something very early just to be sure. Or if there's sometimes with just an area of density, your whole breast isn't always dense. Sometimes it's just a small area, and you can just go have that area ultrasounded. So there's conversations to be had there too, even if you're not a 3 or a 4, and just, kind of look a little bit more at the 2 and see why. Is it just because it's less dense throughout, or is there an area that I want to go look at a little more closely? So
good. Okay, thank you.
Yeah, you're welcome. And then, like you said, it sounds like you've got a great plan. Sometimes it's a follow-up ultrasound, and sometimes it's a follow-up MRI, staggering the different screening methods, which I think is really wise and also very very considerate, and it sounds like you've got a really great plan worked out for you, which is so important when you're working with your gynecologist or your physician that's ordering these, to come up with a customized plan for you based on your age, your density, and your risk factors, so that you have a good strategy, that you know what the plan is and how you're going to move forward, and you can track it, and so can your doctor.
Yes.
And really just know that you're getting the screenings that you need.
Yes. Well, and just in a very pragmatic terms, I typically get it in autumn, Q3, Q4, so that I've met my deductible and they pay for the MRI, because it's not always covered. It's all about knowing the system and working within it, right? So.
Yeah, that's it. And again, it's the coverage too. The insurance isn't required to cover it. I know that's one of the things that we're working on the Hill with the Early Breast Cancer Detection Coalition, hopefully getting that passed as the next national mandate to require insurance companies to cover that adjunct screening, so that we can start talking about those next steps more. And I still think that is a huge step. Going to be really glad when that happens. And like we know with anything else, there's always still the conversation with the insurance company on getting it approved, validating the need for it, right? So the advocacy and the education doesn't stop there. We still need to be speaking up and advocating for ourselves even then, to make sure that some of these things get pushed through, and so that we can get these covered. It's not fair to expect women to pay out of pocket of these. It's not reasonable. Right. It's not even possible for many women. So
you're right. And that's where obviously I'm grateful I can do that, but you're 100%. There would have to be probably a pass in some cases. And yeah, that's not okay.
Yeah,
and we know
absolutely.
early is critical, right? And the irony is there'll be cost to the healthcare system eventually if you don't catch this early. But obviously you don't want women to go through that. And yes, you're right. And what you said about advocating, writing letters, participating, that's where the call to action, that as I see it in all these things, is advocate for yourself, become educated, become aware. But also it's as simple as even jumping in and writing letters to your lawmakers, right? That can have an impact. Joining advocacy groups, putting your voice out there, sharing information, telling other women. And men. I have 4 older brothers and a younger sister, and they all know the story, right? So they can share with their wives and their daughters.
Yeah, exactly. Sometimes they're our biggest champions in getting that story out.
Yes.
As well as writing those letters, right? Because like you said, it doesn't have to always be on us to do the self-advocacy. There's ways others who want to love and support us and care about this to get involved. And those letters are really impactful. I know that you've been to the Capitol with me and seen the result of those, that they are received. They do want to see them and hear from us. So it's not a wasted time. It's not going off into the ethers. They really do make a difference. And so we'll leave a link to that in the show notes for anybody who feels like they want to get involved. It's always nice to be able to feel like you can do something.
Yes, right. Taking even small actions. We all want to have agency over our own health and next step.
Yeah, even at the state level. So
yes.
I think it's important to keep an eye on what's happening at your state level, even if you are in one of the more progressive states that's already got insurance coverage mandated and all the things. It still helps to have your representative taking that to the Capitol. So I'm curious about your experience. What you would really like to share that you think stands out to you.
Number one is having a good girl tribe as well, with whom I share, but they share back. The women, I'm fortunate to have amazing women in my life who, have different perspectives and may have read something different. So having that healthy collaboration with a girl tribe, number one. And taking a role in researching and sharing, and that's number one. Number two, as I said, is not to be afraid to use my voice. And when my sister was, when she was diagnosed, that was scary, but she dialed me into, doctor's appointments and Our mom showed up. So making sure that you have an advocate with you, because it's perfectly natural that when faced with mortality, your mind may not be fully engaged, and not being embarrassed about that. Other intersectional topic, and I hope it's okay if I bring it up, but I am in menopause now. And just also, when I entered, I had preconceived notions of hormone replacement that were actually archaic, and I hadn't done the research, even though I was in healthcare. So that's where my girl tribe really came in, and I started researching for myself and talking with other women and gathering perspective. You know, it may not be for everyone, but knowing the importance that estrogen plays in women's health and knowing the balance, even with breast cancer. So do the research and breast cancer survivors, and don't accept status quo on that.
You're right. A lot of old data that's being used. For a long time, they've told us that hormone replacement therapy is not compatible for anybody with a breast cancer risk. And I think a lot of the HRTs have a black label warning on them as of being a risk for breast cancer or increasing your risk for breast cancer. And there's a big movement to get that removed, citing that some of these studies were not well done and that they are old. The therapies have come a long way. They're not the synthetic ones, and that there's more natural hormone replacement therapies available. And so it might be an option, and it's certainly worth looking into and talking to your doctor about, because a lot of us for a long time, you're right, thought we are just not a candidate for it and got that in our mindset and haven't looked back. And, you know, things have changed. So maybe it is a conversation to have, and maybe it is something that you can benefit from. So it's definitely worth asking and talking to your doctor about, and doing a little bit more research. Like you said, keep an eye on that movement, because it's big. It's really going to change the way we look at hormone replacement therapy, especially as survivors and people affected by it. So yeah, I'm excited to see what's coming from that.
And don't you respect the women that have gone before us, now that you know all that you know?
Goodness.
What they navigated and survived and put up with, that candidly they didn't need to.
Absolutely. My story would have been dramatically different if it wasn't for, you know, hearing the stories of the women that went before me.
And we can clear the way for the women that will go after us.
Yes, all of them. The daughters, the nieces, the friends, the sisters. Yes.
Yes, daughters.
That,
not my, but yes,
all of them.
100%.
So tell me a little bit about the work you're doing now and what what's ahead of you. And I'll also back up just a little bit and let me know what your sort of path for screening is right now. It sounds like it's just once a year, and maybe you're still doing the staggered screenings, but I just wanted to make sure I followed up on that loop, and then I would just kind of love to know what you're up to now.
No, I do actually 2 screenings a year, every year now. Mammogram is one and MRI is the other. So every year I go, so which leads me to believe, and just as you were describing dense breasts, I probably have a 3 to 4 anyway. But I definitely do that. I'm pretty faithful about going to the gyno. You know, still, even with my gyno on the hormones, I would say less aligned there, but advocating for myself. But on the breast health, I do 2 screenings a year, staggered 6 months apart.
Okay.
Yeah. But you're welcome to comment on that based on what you know.
No, I think that's great, actually, the 6 months apart. My sister does that. She hasn't had breast cancer, but me and our mom has, and so that's actually the protocol they have her on as well. Is every 6 months alternating the screening. So I like that one, especially if you're high risk.
Yes, I still chuckle every time I think about going in for the breast MRI. Any woman that's gone in would know, because it's just kind of a first time I went in, I was like, okay, I guess so. There's 2 holes and you lay in.
It's awkward.
It's kind of a chuckle. I just, every time I go in, I have to chuckle. I think, well, I guess this works.
I feel like I'm at the auto body shop. Like you're just like a car up on the thing.
Yes, exactly. Thank you.
Especially if you're getting a biopsy done, because that's kind of how it's done.
Yes, thank you for saying that. I know that was a little bit childish, but I was like, every time it's the way I entertain myself. I don't.
Yeah.
Yeah, through an MRI.
Yeah, no, you've got to find the humor where you can, when you can, I think.
Yes. So that's what I do now, and I'm pretty diligent.
Tell me a little bit about the work that you're doing now, what you're doing in the healthcare space, and sort of where you like to focus your energy these days.
So I've been in the healthcare space 20, and before that in tech, and it was very important to me to join an industry where I could leave a positive footprint with what I do. And leaving tech, it took me 2 years to get into healthcare, and I can't look back. I was with Edwards Life Sciences for nearly 16 years and then broke out to start my own brand strategy firm and marketing strategy to help smaller companies start up early stage or restart, set a strong foundation for growth. I'm really passionate and compelled and working with women-led or women-focused innovations, though all my clients don't necessarily fall in that category. But part of why I think we have less representation in solutions in healthcare is because we have less diversity at the top. So part of working with women-led companies, when I help them succeed and grow, then we're obviously elevating women leaders. It was a little intimidating being on the hill, with someone like you, physicians, and you're all telling your story, and they're like, well, why are you here? Well, I feel passionate about women's health, and how I think that I can contribute is by helping more female leaders succeed and lead companies that are then going to be focused and be more sensitive to creating innovations that are more relevant to women. So that's my contribution to women's health. And again, I know the power of a strong brand strategy. The name of my company is True North, so that companies know where to focus, and especially smaller early stage companies, they need to know where to focus every dollar. And often I hear, hey, it's a little too early for me, but that's when it's the most critical. It's like, if you only have $1, let's invest the time and effort to know where to focus that dollar. If you have $1 million, you may have a little more play, but you still don't want to squander an opportunity. And I was around and in startup land early 2000s, and just saw so many companies with great innovations that could help change the world falter and close because they didn't invest the time and focus early on. That was the era of big retainers and big spend, and then it all burst, and I thought, let's see what I can do. And I was too early in my career then, but in this chapter of my career, this is where I would like to bring beautiful innovations to life. And this is how I think I can contribute.
Oh my goodness, it sounds like such a great marriage of everything that you excel at and are passionate about.
Thank you. I do say that there's such a convergence, and it's corny, but I really think everything has led to this moment.
Yeah.
I was, like I said, intimidated to go on Hill Day, and I thought, well, I'm passionate. I'm going to go. I had never been, and what an inspiration. I can't look back. I met you. I met so many other women, and you've asked me to be here. Hopefully my voice contributes, and I'll share your voice with my network, and we can help each other grow and thrive. So I guess let's just step out like you are doing. Let's just each step out.
Well, thank you. And I want you to know that for someone like me, especially being on Capitol Hill, but even in the everyday work that I do, of course, we hear from a lot of survivors, and it is really important to have survivors share their story. But it is equally as important to have you out there sharing your story. There's so many women out there that think that their story isn't as important or as valid, but those stories are the one that's pre-diagnosis, so that you can learn how to advocate for yourself and get the information so that you can have that early detection should that be in the cards for you, but at least you know that you stand a chance at having early detection by being well informed. And you're exactly the person that we're hoping to speak to, but also having you add on behalf of this, I think it's really nice. It feels like, there's a whole team, right? Like we don't have to do this alone. And I really think that that's the message, is that it takes all of us. We don't have to do it alone. Our caregiver's voice, our family's voices, they all matter. And I think, for me sitting there at the table, hearing people like you share why you're there, I'm like, oh my God, this is so good, right? So I think that we're all just like really grateful for each other. And I was there last time. There was a young man with us. His godmother had been diagnosed with breast cancer, and he was just sharing the impact of that on his family and his upbringing and what she meant to him personally in his life. And it was really moving and really encouraging to see and be with somebody like that sharing their stories. So really powerful. If anybody's just hearing this and feels compelled to get involved, don't feel like you have to have, a big diagnosis, or that you need to have anything more than just a passion for wanting to support this cause, is all you need to get involved. That's the only requirement. And then switching topics just a little bit, the work that you do with especially new founders, I will just have to say yes to all of that, especially in the early days. Like knowing where to focus is one thing, but then also having the ability to do it because you're wearing every single hat, you're running everything, your attention is being pulled in a million different directions. Plus you've got a lot of ideas spinning around in your mind, and you kind of want to execute on all of them. Right. So having somebody like you to really solidify and distill what's happening and give you a path forward that really makes sense for you and whoever it is you're trying to serve, I think is really valuable. Just want to echo everything that you just said.
And one thing that I would add, and it's not a plug, or I guess in a way, but it's just in healthcare, I was so shocked at how long and hard it is to change clinician behavior. If what they're doing is generally working, changing their behavior could introduce risk. And so right now, I think the stat is still 16 to 18 years, even with all the studies. And this is where perseverance, understanding the clinical setting, but even in patients, right? Changing patient behavior is also challenging. We know the data around that. And this is where perseverance, I seek to understand, behavioral science and behavior change, and what we can do to reinforce positive behavior in both clinicians and patients, and what you're doing here, sharing the information, giving reinforcement. We'll reach obviously clinicians and patients. I think that's where we would all say, I'm not biased, and probably, even my gynecologist say, I'm not biased, right? But being understanding of clinicians' days, their experiences, and seeking to continue to give them new information and data to help change the behavior when we know the studies are there, that time to change clinical practice. That was a long soapbox. Feel free to edit as you need to, but that's where I just am surprised how long it takes, and it just takes showing up and perseverance and fortitude. I love that word. You used that earlier. To do that.
Yeah, exactly. I mean, I got involved in this work back when I got diagnosed with dense breast tissue and breast cancer, and that was 2015.
Wow.
And it took 10 years from when I started. There were people doing this before I started that were just trying to get the law passed that we even tell women that they have dense breast tissue.
Can you imagine?
That very simple step.
Yes.
So yeah, it is kind of mind-blowing, which is why these conversations are just tenfold important. We got to get the information into the hands of the woman walking into the doctor's appointment so she knows.
And don't you think, then maybe even clinicians, even though the data was out, didn't believe it was really that big a deal, or I don't know if then they thought mammograms were sufficient. I don't understand how they couldn't. But, it wasn't like someone said, oh, I'm not going to share because I want to hurt women. They just thought, oh,
Yeah.
I'm not going to share because of XYZ. I don't believe that they were like, oh, I'm not going to tell women because I don't care about women. That's not the case, right?
Right. I think it just depends on what clinician you talk to, and they would have all given you a different answer for,
Yes.
what was happening
So
at that time and what went into that decision-making process. And maybe some of them just truly didn't know.
true.
And even more recently, so for many years in the beginning, the education was that dense breast tissue made it hard to see breast cancer on a mammogram. And we thought that was as far as it was, that it was just that type of a risk factor. And then with more study and more research and more education, we found out that dense breast tissue actually is a risk factor, that you are more likely to have breast cancer in the first place. So it's a compounded risk factor. And that's only come out in the last couple of years. So it's becoming even more critical to really understand what this means, whether or not you have a family history of it, because up to 50% of women are walking around with dense breast tissue. So you can imagine that, this is prevalent and it's important to understand and follow up on.
Yes, and thank you for sharing that data. I mean, obviously you are wise to do that, but I didn't know it was an independent risk factor.
Mm-hmm. Yeah.
So there even
it's
deeper
twofold.
knowledge now. Yes, twofold. Creates a sense of urgency around it, or at least weightiness.
Anything else that you would like to share that's on your heart before we close out this conversation?
As corny as it sounds, I just want to thank you for stepping out. I know I said that already, but I am consistently reinforced how big an impact even one person can have, as given the ripple effect. So encouraging women to share their voice and to step out, even your gesture is very large, right? Your initiative is very large, but even with a small gesture of telling one other person of what they heard today, I think could make a big difference. Even as a call to action, talk to anyone who you think would benefit from this information, share the link,
Yeah.
share the data but it's just one step. Do one thing today
that.
would be it.
Yeah, I love that. Keep it simple. It's don't lose sight of how important and impactful that can be.
Mm-hmm.
And I'm so grateful to you being here and the advocacy that you're doing and the personal support that you're doing and just the way that you continue to cheer us all on as you stand shoulder to shoulder with us and advocate with us. It's just makes it a lot more enjoyable to have that army of women with you. Men and anyone else who wants to be involved, it really does matter. And we'll leave all those links in the show notes that we discussed, as well as to the Clear Pathways program, which we're working on here, and a way to get involved there. Join our volunteer team, our task force, or our advisory board.
Yes.
And of course, reach out if you have any questions. I know I am here for it, and there'll be contact links to reach out to Susan if there's anything you want to connect with her on about advocacy or about the other work that you do. So thank you so much for being here.
Appreciate your time.